This is Sarah Meixel, and today we're here with Dr. Ivan Leyva-Baca. He is a veterinarian and product application specialist with Thermo Fisher Scientific. Thanks for being with us today, Ivan.
My pleasure, Sarah.
Today we're here at the international meeting for the National Mastitis Council here in Milano, Italy. Can you tell us a few highlights that you've experienced at the meeting?
Sure, it's been a great meeting. A lot of the international scientists that focus on mastitis research are presenting their findings here. So it's quite an important meeting to be at. So there's been a lot of presentations that are outstanding, but some of the ones that call my attention are one from the group of the Netherlands, where they've been focusing over the last 10 years on investigating selective dry cow antibiotic therapy. The goal of that type of approach is basically to reduce the usage of antibiotics in the dry period of the cow by basically doing a selective treatment. That means that previous to that they were treating every quarter with antibiotics, no matter if the animal was infected or not, or if they had high or low somatic cell scores. Versus the approach now is basically focusing only on the ones that are having a high somatic cell score. So that's been really outstanding in the conference. Basically the results are really remarkable because they've been presenting that by the results said that the reduction of the usage of antibiotics also reduced the resistance of the microbials present in those animals, and that's pretty outstanding. And in the case of animals that they've been pretty much treated as a blanket therapy, the resistance of antimicrobials in those pathogens has been pretty high. So it's a new finding that it's pretty promising. So it's been basically pretty nice to see that.
And Ivan, what role are diagnostics playing in selective antibiotic therapy?
It seems that in those studies it was a big role. Obviously, what they were using mainly was somatic cell scores to determine if the animal needs to be treated or not. They have their own thresholds, but whenever that threshold is exceeded, then it triggers basically antibiotic treatment. So with that approach is basically a good approach to reduce the usage of antibiotics. However, there's different tools that can be implemented for the next generation of diagnosis, such as molecular tools, that can give you a little bit more granular answers about the type of pathogens that are present in those infections versus just knowing that there's an inflammation process going on due to infections, which is the answer that somatic cell scores give you. So we're pretty excited about partnering with some of the groups in the following years to execute studies that can give them a little bit more granularity on the pathogens present in those others during infections.
Very good. Well, thanks so much for all the information today.
You're very welcome, Sarah.
Thanks. This is Sarah Meixel reporting.